I'm now in conversation with Rahul Kakkar. He's based in North Carolina in the USA. He's a medical practitioner. He's going to be involved in our webinar on remote continuous care monitoring. So I'd like to find a little bit about Rahul's background and what he does at the present time. So have you been involved in medicine all your career, Rahul?
Yeah, hi David. Yes, thank you for having me. I've been involved in medicine all my career. I started in India and I was trained as an anesthesiologist. And then I moved to United States in 1995. And after that, I pursued career in pulmonary medicine, critical care medicine, and sleep medicine, doing all the fellowships. And my practice now centers around primarily pulmonary and sleep disorders in both adults and children.
Okay, so this is Prana Healthcare. When did you set up Prana Healthcare?
So I started Prana Health approximately 4 years ago.
Okay, and you have a mixture of patients, which can be adults and children as well. Do they tend to be patients with chronic conditions that you deal with?
Yes, most of my patients are with chronic conditions, and we have a lot of people with different kind of sleep apneas, obstructive, central, complex, hyperventilations. Then I have patients with chronic lung diseases, starting with COPD, pulmonary fibrosis, pulmonary hypertension, and many other chronic lung diseases. I also have children with different kind of sleep apnea, sleep disorders. I also treat patients with narcolepsy of all ages, and we have a lot of children with asthma as a chronic lung disease.
Mm-hmm. And so patients like this, to be able to look after them remotely, how did you start to look at the technology for remote continuous care monitoring?
Well, in a way, I was already involved in looking at sleep patients remotely for several years, even before the term remote patient monitoring, as it's known in the United States lingo, came in. I have been downloading the data of the CPAP for many years, and we have been monitoring these patients' response to CPAP therapy for several years. And it's very important because it's been known in sleep medicine that it's easy to do the sleep studies, but hard to get the patients compliant with the CPAP. And my experience as far as going back several years to Florida was that if we were closely involved in the treatment monitoring of the CPAP adherence, apparently, and this was also actually fed by the CPAP adherence therapy and data, that we can increase the adherence. And once we studied our patients in Florida several years ago, was 90% adherence rate as opposed to national average of 45, 50%. And now even with a mix of, yes, pediatric and adults patients, our CPAP adherence rate with even the mix of adult and pediatric sleep patients is about 85%.
Well, that's pretty impressive if you can double the adherence rate, because compliance in a lot of medical conditions is a real problem, particularly if you're having to support them remotely. So we were talking earlier on about the situation in the UK as far as care homes are concerned, and we've had recent reports that 25% of all COVID-19 deaths have taken place in care homes because it seems that we weren't really as prepared as we might have been for dealing with this. I understand from what you were saying earlier that the situation in care homes or nursing homes in the USA is somewhat different because you responded a little earlier. Can you say a little bit about that?
Yeah, so, the first cases of COVID-19 in the United States were reported from a care home or nursing home, as we call them here in Washington. But I think after that, a lot of nursing homes took precautions to prevent these older patients from getting infected. And they have placed in strict guidelines, decreasing significantly the number of visitors that can be allowed and screening them for symptoms and temperature. But still, despite that, in my state, North Carolina, we have several reports of the nursing homes slash care homes becoming hotspots of outbreaks because it's very contagious within those spaces, confined spaces where these people are there, and then they're also more prone to the infection.
Mm-hmm. So you were talking earlier also about the phenomenon, is it happy hypoxia, which is where patients can be asymptomatic, but they could be in a serious condition because their oxygen saturation levels go very, very low. I understand you've read a report about that.
So as some people prefer to call it happy hypoxia, other people call it silent hypoxia. And we know that in COVID-19 infections, it's quite common. And these patients can have their oxygen saturations into even 70s and not have many symptoms. Apparently, these patients also have poorer outcome if they're not treated and recognized in time. The exact mechanism is not known, but it appears that these patients are also high risk for pulmonary embolism or maybe some increased inflammation in the lungs, decreasing the diffusion capacity of the lungs. These patients are the ones which will probably benefit from newer technologies, especially these continuous monitoring devices, something like oxytone or similar devices, which can provide continuous oxygen monitor at home, and the data can be fed to a dashboard where they can be monitored, almost like an ICU out of the hospital. And so, one of the things that concerns is the surge of these patients in the hospitals, and they're not able to care for every patient that comes to emergency room. There are some surge clinics some hospitals have opened, especially like Mass General. So they evaluate these patients outside of emergency room, and they send the patients home based on their symptoms. I think those are the patients, if you want to make sure they don't have silent hypoxia or their vital signs are not deteriorating, to put them on remote patient monitoring devices or continuous monitoring devices like oxytone or similar ones.
And I guess one of the things about oxytone, I mean, this is not a sales pitch particularly, but having a wrist-based device for a lot of the type of patients who may be at risk is a lot more convenient than having to have something that's on the end of the finger or other locations.
You're absolutely right, because these patients also have a high risk of readmission. So not only just that, and similar to other chronic lung disease patients like COPD, for example. One of the markers, quality markers in the United States is 30-day readmission rate for COPD patients.
Right.
And I believe that even those patients will benefit tremendously because some of these devices like oxytone not only provide oxygen monitoring, but also temperature, respiratory rate, fall risk, activity. And we know that in these patients, outcome is more dependent on the activity, and it can also measure their stress level now.
Yes. Yeah. So you're able to provide alerts and response. And I guess the question that I have about that is to do with in a domestic environment. Obviously, in a hospital, if you're in an ICU, there is a nurse at a nursing station. I guess in nursing homes, you have qualified staff. So if there is somebody on hand, if you get an alert quick enough, you're able to respond more quickly and stop the patient having to go into hospital, into an ICU.
Yes, I think it'll be supplemental because there are only certain number of nurses in a care home or a nursing home. And a lot of these patients are not hooked on to continuous monitors like in a hospital setting. So wearables like this can provide continuous data to trained respiratory therapists or nurses, and they can review their data periodically and see who actually desaturates, for example, at night, or has
Yes.
heart rate variability, and so.
Yeah. Well, I think you'll find the discussion in the webinar interesting because one of the other panelists is uh, a guy called Chris Barker, who's the CEO of Spirit Healthcare, and their primary type of patients are COPD patients, and they have a solution called CliniTouch. It's not using continuous real-time data, but it's using data collected at different times during the day, and it goes alongside a patient education program and remote care program. And this seems to be becoming more of a trend, not just in the UK, but also in Europe.
You're
So
absolutely right. Yes,
yeah,
absolutely.
yeah. So, is there anything else you would like to add about your work in Prana Healthcare before we finish the interview?
Well, we are just excited to be part of this, and as we took on this remote patient monitoring pretty early on, and we also monitor our patients about use of their inhaler devices. Actually, we put some sensors on their inhalers. So
Ah,
that
okay,
also gives us a good early warning if they are using their rescue inhalers more, or
right,
if they're not using their maintenance inhalers in time.
right.
And now that we are actually looking to expand these services, we're trying to engage some of the local hospitals, some of the university hospitals, to see if they will be interested and decreasing their readmission rate and providing better monitoring of their patients.
Yeah, I guess adherence to the clinical regimes or compliance to the clinical regimes is very important, and at least being able to monitor in this kind of way does help you to pick up the fact that people are maybe not using their devices as they should do, and respond to the situation more quickly. And at the end of the day, if you can keep people out of hospital, it's going to be beneficial both to the patient and to the public health services.
Absolutely.
Yeah. So
Absolutely.
thank you very much for your time, Rahul. I look forward to speaking to you again tomorrow in the webinar, and I'm sure the delegates to the webinar will gain a lot from what you have to say and from the rest of the webinar. So thank you for joining me.
Thank you for having me, David, and I look forward to joining the webinar.